right. Hello, everybody. Welcome back to Interoperability Unlocked, where we share insights from the intersection of trust and community and all things health data. We're so excited to be back after a couple months hiatus here. Between travel and events, it just got a little crazy. So we're excited to be back. Today, we're bringing back a familiar face and my new co-host. Paul is lucky enough to be stuck with me reoccurring on this show. And we're super
I don't know.
excited
My
to
screen
have
has.
our newest team member, Jasiah.
I was gonna say my screen has Jasiah to your right, so I think she's the co-host now, and I'm just a guest. So that's
Oh,
cool. I don't know.
well, either way. But we're happy to have Jasiah. She's our newest team member. She is handling all of our policy and network operation stuff. And today happens to be her birthday. So drop a comment, leave her good vibes for her special day. And we're super excited. So welcome to you both for joining me.
Thank you.
Happy
Today,
birthday.
Thank you.
Today, we're going to discuss a recap of 2025 for CommonWell and the Alliance. We're going to go through some policies with Jasiah, and then we're also just going to pretend that we have a little crystal ball and take a look into 2026 and what we're thinking might happen next year. So, Paul, let's start with you. As you kind of look back on the past year of CommonWell, what are 3 things, I'm going to keep you to 3, that you're most proud of?
Well, I'm still alive. No, that's probably not a good CommonWell one. Well, first of all, we built a decade of building stuff, and I'm proud that we can move from one big platform to another big platform and not really see a blip in what we do. For those who are in the know that we exited our legacy platform. We built a TEFCA one, well, a TEFCA ready one that was also designed to be our future generation one with our partner LK. And I wouldn't say zero effort. I wouldn't say it was like easy, but it was relatively transparent, and everything's moved over that wants to be moved over. And we're also the biggest participant in TEFCA, mostly through our partnership with Athena. So I say that's a pretty good success, and we're seeing more and more exchange every day. So I have to do 2 more.
Yes, let's do 2 more. We have a lot to be proud of.
Yeah, fair enough. Second, really proud of the push amongst the Alliance to respond to individual access in the process of doing that. And then in the reaction from the market for being recognized for doing that. We have, we're not going to toot our own horn too much, but it is kind of, we are hosting this darn thing. So we have over a dozen individual access service applications or companies in integration testing right now. I think the number is actually 14, but I said about a dozen just to make sure my math isn't slightly off. That's a lot when you consider odd members, right? A nearly 15%, 20% growth of just that application type in and this is the last 3 months. So it's not even all 2025. In addition to that, adding another 5 members on the treatment side, continuing to grow while there's a lot of angst and machinations going on. I think I don't know if that's a thing I'm proud of. I'm proud of the industry for doing, right? There's a lot of questions and unknowns, and we're still doing it together. And I think that's a pretty good achievement. What else? Let's see. I'm going to go with our summit. We have, and actually that was Jasiah's first exposure to the community of CommonWell. I always advertise it as, or market it or explain it as a meeting of the willing, very productive group, not exactly a lot of marketing and fluff. And every year, through the grace of some supreme deity of your choice, we actually pull it off. It's Courtney's torture and Marina on the operations side to kind of get all the contracts and stuff done and get everybody in the same room. But once you get there, the really proud part is the feedback we get back every time. I was like, that was actually worth my time. And that actually worth my time, that word actually is almost obnoxious, but I know exactly what they're saying when they say that, right? Because I go to so many conferences and so many events where I knew this already. Yeah, okay. Sometimes you need repetition, and like Jasiah, no offense to you, you're probably like, oh, keep repeating it because there's probably 25% I gain every time until I get to 97% and I get it.
Yeah.
But when you do this for a while, you go to a conference, like I learned 1% today. I spent 2 days traveling. And yay. But ours, I always learn a lot. I think everybody learns a lot. It's always fun. So pretty proud of pulling that off again. And there was 120 people there. We don't try and make it's not like a big conference. It's just a meeting of our friends to make sure we're doing stuff right.
Yeah. Talk about what's important.
Yeah.
Perfect.
That was 3. You said 3. I can name more.
You have another one that you're dying to share?
No, it's okay. We got other stuff. What's going on?
All right. If I had to add, I just like crunching numbers and doing like our year in review kind of stuff for social. We've added almost 20 members this year, which you just mentioned we have like, a total of 70. So we added 20 this year. That's a huge chunk of the Alliance. So that's been incredible and very exciting. And also like just deepening our connections with some of our key players and like our board members, and moving into the new year. I'm really excited about what we're going to try to do together as we kind of move forward with this alliance and like the notion of like interop together with them. So that's something I'm super excited about that both reflects the work that we've done this year and the work that we're taking forward into 2026. So Jasiah, looking into some policy stuff, let's switch gears a little bit. What are some of the most like important policies that you're kind of tracking as we head into 2026?
Yeah, I mean, there's a lot to be excited for going into 2026. For me, particularly just being new to this space, I'm hungry to learn more and track these things as they evolve. The first thing I'm really excited about is just looking at kind of CMS aligned interoperability timelines and how influential they're going to be in this coming year. There's going to be, a lot of movement on enforcing and implementing sort of things around interoperability and patient access requirements. And we're seeing kind of CMS tighten expectations around certain things like prior auth, FHIR-based exchange, digital quality, like data measures. And I think we're going to be seeing a lot of vendors and providers having to adapt as these things change in the coming year. And a lot of kind of what happens in 2026, I think, is going to be shaped by how CMS sort of enforces these deadlines and how they reinforce compliance this year. So I'm also closely watching information blocking updates. So we've seen ONC signal that they want more clarity and accountability in this space. What does reasonable exchange behavior look like? And this is really important when the ONC updates information around this space because it shapes how networks like us in CommonWell, how we behave and how the broader ecosystem operates. So the hope is that having more specificity in this space will make exchange smoother. Also, I apologize. The sun is like coming and going, and I'm watching the lighting shift. It's kind of crazy, but it's exciting because I think this updating information with information blocking will hopefully decrease kind of the grayness in this area and just make it easier for organizations to know what's expected of them to do, proper exchange. And finally, the last thing I'm kind of excited to look into is API recommendations and standards and how they're going to continue to shift. And I think as FHIR APIs mature, we're going to see more emphasis on real-time exchange and also patient access. One thing that I think is interesting is APIs are going to start being something that it's not just something that you have, in your toolkit, but it's going to be something that's actually reliable, consistent, and scalable. And that's going to really impact how networks interact with each other and how data moves across different networks like Carequality and TEFCA. So overall, I would say what I'm excited for in the coming year, it's just going to be a year of alignment, a lot of different moving parts coming together to create more predictable and hopefully standardized exchange. And that's really exciting.
For sure. Paul, anything to add?
No, I think that's all very well astutely observed. You can hear me, yes? I changed my microphone because I had some background noise. Good. Just making sure when my dog goes berserk, you all don't hear it. I think that's right. I will say I was on a call this morning with someone, and I always like to bring stories to the table. And I will say sometimes you get a little worried that we're moving a lot of data around. People aren't using it right. I heard a story of like a hospital system that wasn't using external lab data because they don't trust other people's lab results versus their own. And as we think about what's going to happen in 2026, I challenge everyone to rethink that stance. There's a push for individual access, and if individuals have data that providers aren't using, it's going to cause a weird conflict between what the patient expects and what the provider expects. So don't be an internal blocker, I guess I would say, because the information blocking is like entity to entity, but then there's inside the EHR and inside that organization, is this lab screen allowed to show external results? Right? We gave them to you. It's not being blocked. Everything's sharing it to you, but you refuse to look at it. Why? And how do we unlock that kind of thing? So, it's going to be an interesting movement as we actually start to see data usage go up now that data is moving pretty, I wouldn't say frictionlessly, but in the treatment exchange cases, pretty frictionlessly. Is that a word, frictionlessly? We'll say without friction, because that sounds like I might actually have taken an English class. I've got a daughter taking SATs now. I should know not to use words that don't exist.
You got to be a good example.
Yeah. Oh, the SATs. Okay, so very busy year ahead. We know this. If we're looking into our crystal ball, what else do we think is on the horizon this year? Paul, let's have you go first.
Yeah, there's no doubt that individual access is skyrocketing. And when I say skyrocketing, the number of entrants coming in to work on it has increased a lot. The volume of data has not. So if you're predicting it's the volume of data next year is going to increase exponentially from a provider database into the hands of a patient's chosen application, right? So, we're doing 1.2 billion documents a month. That's just CommonWell alone. That's not accounting for care quality to other care quality implementers and TEFCA and all that stuff, and they're all doing great work as well. It's a lot of data moving around. If you ask me how much of that's going to patients, it's in the hundreds to thousands, right? Not with a billion or a million attached to it, right? It's a very different level of scale. But that was with the early willing that came by in 2016 to 18 and kind of slogged out and waited a while. The acceleration today, Athena participating, all the QHINs up, and it's going to skyrocket. Add zeros, right? Adding zeros is a big deal. Go from thousands to tens of thousands or millions is probably the likely course. And it's almost a bad to predict. The rest of the things would be a little bit more spicy, but I think that's a easy one. I'll give a call on right now. And I've been hesitant to make that call for years because we've had fits and starts that didn't get to where we wanted to get to.
Yeah, for sure. You're keeping Spicy Paul at bay today?
No, I'm just making the primary prediction because I think I've been wrong on this before, right? So I've been like, we could talk. We're finally going to get the fire. Nope. I'm actually, I feel like there's a bunch of these companies that are growing up right now that have huge valuations on betting markets, right? They're you can bet on the activity of something, and therefore the masses tell you what's really going to happen because you can see the average. I think if you actually polled people on average and says, are we going to move to fire next year? You'd get a muted response. There'd be a lot of people holding back, and you'd see that betting market say 22% likelihood, not the 75% we're really looking for. You look at CMS aligned networks, you look at what's going on in TEFCA. There's a lot of formative work going around fire, but CCDAs, those documents, the documents we're changing around, they're not going away. And this is an industry that still has the highest percentage of fax machines in offices of any industry I know of. So this should be of no surprise to us that we have a data between each other that's not going away as fast as we want it to. I do think we're going to see advancements in use of fire, but I don't think it's going to go anywhere near the scale of document exchange, no matter how much we'd like to think otherwise. But I'd like to be wrong.
Fair enough. Fingers crossed. Jasiah, I know you already told us what you're kind of excited for the next year, but to summarize, what do you think is coming down the pipe as far as policy in 2026?
Yeah, I think for me, the biggest expectation is just seeing TEFCA continue to mature and really be that anchor for the interoperability community. There's been this wave of QHINs that have already shown that the technical and governance pieces of TEFCA can work at scale. And I think this is the year of seeing that value continue to deepen. And I think as more networks and vendors and providers come onto TEFCA, we're going to see more consistency in how exchange happens. Right now, there's still, I would say, like some variation. Different networks operate slightly differently, have different kind of processes in moving, and there are also different APIs that are at different levels of readiness. Yeah, but like ultimately, TEFCA gives us a common set of rules. There's a space of trust and a consistent way to participate, and that stability is really important, and I think is going to help accelerate everything that's been done so far in interoperability. I'm very new to this space, but I can see that TEFCA is like really bringing like a decade of work, together and consolidating it. And I think it's just going to be a foundation at a national scale of just expanding exchange. And I'm hoping we'll see more support for use cases from treatment, patient access to public health, all under the same trust model. And again, like I keep coming back to this idea of consolidation. I think that's what I keep thinking of when I think of 2026, and that will reduce the complexity of just exchange and make it easier for participants to operate across multiple different scenarios. Yeah, reducing complexity, I think, is really important. So, yeah, I think 2026 is going to be the time of TEFCA being less of something that organizations are like preparing for or like hoping for or preparing to get on. And it's going to be something that a lot of orgs are going to be actively leveraging. There's going to be more use cases, deeper connectivity, hopefully more momentum around APIs. So it's just going to be less like a project that people are checking off their checklist and more like an actual strategic asset, I would say. So yeah, I think the continued growth of TEFCA is really going to anchor the industry and bring more predictability, consistency to how data is going to be moving. And again, I've come in kind of recently, and I have already seen so much evolution in this space. And I think 2026 is when the value is just going to increase, and I'm excited to witness that.
That was me retrieving a slipper that my dog had found somewhere in the house. Sorry about that. Yeah, we work at home, people. Weird things happen. Yeah, I think that's right. I guess if you want to get to this, the spicier thing, it's not spicy to say. It's actually the background of it is spicy, right? The one thing we're having trouble with is bringing on providers that you and I would recognize as a provider, no matter if you walked into a practice and saw their degree on the wall and white lab coat, and they do like, oh, this is a healthcare provider. It turns out there's a bunch of those that are hard to identify from afar. So if you just put a website up and say, okay, something, conciergemedicine.com, if I walked into that practice, I'd understand. But from a distance, like going, hey, is this a provider? Should I really be exchanging it? Is this are they really a treating thing? Where's the security stop? I think we're finally going to see TEFCA embrace expanding trust, not engendering trust that already exists. Right? We clearly trust things that other things trust. So like a Medicare, a hospital system that does fee for service under Medicare was vetted by Medicare and other things to accept these payments, and they know it's a provider. But when we get to these free clinics and other things that don't have a digital trail of billing and the like, we actually have trouble from a distance saying that this thing in the middle of Ohio exchanging with another practice in New York, that they should understand and trust that they exist. They are a real provider, and they look like them, and they talk like them, and they are the same thing from a interoperability bubble perspective. And I think we're finally going to see that bubble expand, stop hemming and hawing about the risk of the thing and say, what's the risk of not including that thing? And we have to get there. There's a definite desire to bend the quality cost curve, or at least cut the cost curve down and maintain quality, or increase quality and don't make it cost more to do it. And exchanging data is probably the best shot we have at doing that. And that includes getting patients their data so they can help actively do that and say, how do I manage that myself? So I'm hopeful, and the spicy part is the background to why I had to say that. We've been blocking the participation of a whole lot of entities onto these networks because we don't know how to trust them based upon the digital trail they can't produce. And that's not their fault, right? They're providers doing a good thing, and which is providing quality healthcare to individuals that need it. And we need them here. We can't think in the opposite direction of, prove to me they should be here. The proof is in the pudding. They provide services to patients for a reason. They trust them, and we have to get them on these networks.
For sure. More trust and lots of work ahead for 2026 is what we can for sure predict. So thank you, Jasiah and Paul, for joining me today. We will be back in January with another show. And until then, thanks for joining us today, and happy holidays, everybody. Take care.
Thank you.
Happy holidays.